Welcome back to the Pulse on the Joy News channel on Malta TV. And let's now talk about you and your health today. Yes, you may get up today and go to work. You might think you're living right, but there's every chance that your activities may be pushing you closer and closer to diseases and even conditions that you may not be aware of. Well, in the wisdom of the Ghana Health Service and USAID, they have thought it proper to launch a program to help each and every Ghanaian in the country today to live a good life. And it's not just a four-letter word of being good, but implementing certain measures that will see us live longer and have a happier and prosperous life today in Mother Ghana. But how are we supposed to do it? How are we supposed to go about this entire process beyond the campaign? Well, joining us for the discussion today is Andy Opoko, the media advisor for USAID Communicates for Health Project. He's to my extreme left. And Madam Joanne Schubert is the Chief of Party Communicates for Health Project. They're all here to give us a better understanding of the relaunch of the Good Life campaign and what we can all do individually to live a better, or should I say simply, a good life. Thank you so much for joining us today.
Thanks.
Right, I'll start with you, Andy. Andy, I remember in 2010 this program was launched. Many saw the posters around and said, what's this all about? Live it well, good life. What's happening now 6 years down the line?
Yes, thank you so much for the opportunity. After the launch in 2010 and the assignment about it, we thought it wise to review it. And basically, when you do any project, you need to pull back, review it and evaluate it and look at the impacts. Upon basically evaluating it, we saw that we have to actually make all our messages action-oriented to try and get healthy behavior styles that will cause people to take up action. So what we've done is we have refreshed the old Good Life brand into a new one that has a different form of communication. And this one is not a single one-on communication like family planning, like malaria, like WASH. This time around we're doing an integrated approach. So integrated communication means one messaging, you get a lot of lifestyles. So you're moving from hand washing to malaria. So you could see even our promos, we're telling you about maternal and child health, pregnancy and the rest. So we don't want to now form about single communication, but we want to form about integrated
the approach and getting the best results. But let's look at the genesis here, and I'll put this to you, Joanne. When you say people need to live a good life, that sounds a bit simple, but what are the details in all of this?
Okay, the details are simple, actually. We've been talking about so many different everyday things for so long. We've been talking about washing hands under running water. We've been talking about family planning. We've been talking about bed net use. We've been talking about breastfeeding. There's so many things we've been talking about. But because they've been the same messages, maybe in different formats, maybe very entertaining, but people are like, yeah, that's interesting, but then they don't do anything. So what we're trying to do is make it interesting for people to adopt simple behaviors that they've heard about, but they perhaps haven't put them into practice. And then they'll see that cholera doesn't have to be something that is plaguing the country. If everyone would wash their hands with soap and running water, we'd see an incredible reduction in that. If breastfeeding, if everybody would initiate breastfeeding within 30 minutes of birth, we'd see an amazing reduction in the postpartum hemorrhage, all kinds of benefits for the mother, but also for the baby. It's the first vitamin A. There are lots of simple things like that people have heard, but perhaps they think, oh, we've heard them, but that's for somebody else. That's too simple, perhaps.
But you see, much as you look at these simple things that people can do, it goes back to why they are not doing it, what the challenge is. And Andy, I'm sure you relate better with this, because when you go to these communities, for instance, where sanitation is a problem, sanitation alone comes with these two headaches: cholera, malaria, and other things to think about, diarrhea and its accounting problems. Why is there such a big attitudinal problem for Ghanaians in doing the simple things to keep our lives better?
Yes, I think basically it has got something to do with about apathy, lack of people's attitude to change, so they become apathetic. But what we're trying to do is to push the agenda forward, that the simple things, the everyday things that you do could save your life. So for instance, in the northern region or in some of our rural areas, they have developed a tippy tap. It's just a simple gallon that they put on a tree, and when after going to maybe the washroom to do whatever you had to do there, you come in, you step on it, you pick a stop, you step on it, the water pours down, and it's a nice thing, and they are using it. Because if you don't have, you have to wash your hand under running water with soap. So we are improvising measures. So we have other partners that we're working with on the ground to actually get the messages across that, look, the simple everyday things you do, washing hands with soap, will reduce cholera drastically. Other simple things you do, that just sleeping under treated insecticide treated nets, will reduce malaria drastically. So they are just basic things, that everyday things that we know you will do, and we will get the best results. So
okay,
that is the
now to look at what's going to happen in the future, we need to take a step back and see what kind of progress we've made in the past 5 to 6 years since this program started. Joanne, what are some of the things that we can look at and say, Good Life started in 2010, we've done so much in this area, but there's still a lot more we need to look at?
I think the area where we're really trying to concentrate is newborn care. That's a place where we still have too many children dying from asphyxia when they're born. It's just people perhaps health providers don't recognize it. Perhaps there are other things that can be done ahead of time to prevent it, but it's things like that are still major problems here. We still have major problems with anemia. It's a question of how you eat. It's a question of when pregnant women go to antenatal care, they're offered iron folate tablets. A lot of times they don't understand why. They throw them away or they don't take them. Things like that, they're just at your fingertips. But people don't recognize that these can make a huge difference in terms of, for instance, when a child is born, if the mother was taking her iron folate tablets, if she was taking the other medicines that are available in the health facilities to take care of malaria, so and taking advantage of the free bed nets that are offered too. Those simple things can result in a child that is of a better birth weight, is stronger, the mother's going to be stronger too, and then when the child starts developing, they're just off to a much better start, because a lot of those things that happen between the mother becoming pregnant and 2 years, they last forever. They're at the root of some of the problems with diabetes, asthma, things like that. You don't realize it, but some of those everyday things that happen right from the time a woman is pregnant have long-reaching implications for people's health and their cognitive ability, their ability to go to learn at school, and also work. Okay. So they're tiny things, but with massive implications.
Okay, sure. So in all of this, Andy, I have to come back to you on this. Yes, it's been relaunched today, but for those who are watching, who are sitting back and saying, nice picture, I like who I'm seeing, I like the idea, what do I do to contribute in my own small way to make it happen?
Yes, what in the next couple of weeks from now, what we're doing is we're implementing a comprehensive program to reach out on the Good Life. Good Life now has become a brand for the Ghana Health Service, and at which all communications in the country from all development partners, by that I mean UNICEF, DFID, and all other development partners working within, are going to plug into it. So we're going to harness all our resources. So for instance, when we're doing the hand washing that we've been showing on your network, that listen, we don't want people to duplicate it, because these messages we have to harness our little resources to maximize our reach, and also to plug into reaching out to action-oriented programming and messages. So we're not going to just sit back and just do the normal entertaining communication. We're doing an action-oriented communication whereby you have to go down, you do the above the line, and you do the below the line.
Exactly.
So we're doing the above the line media and SCB, social and behavior change communication, and try to activate it on the ground. For instance, net distribution, we don't want to say sleep under net. So the Ghana Health Service, the National Malaria Control Program, as we do that sleep under mosquito treated nets, insecticide treated nets, they go down the drain into the communities and begin to distribute nets for free. So that's what we're doing, so that people can have access to these nets, and that they sleep and they get free of malaria.
Okay, so in all of this, and it's a relaunch, and so I need to ask, I know it's an elaborate plan for what, the next 5 years, like this for the past. What's the first year target? What do you seek to achieve in the first year with this program? Okay. Any of you can take it.
I think we're trying to see a shift in social norms. I think, as Andy was saying before, people have become apathetic about some of these simple things. We want people to get charged up. It's like anything. Over time, people just stop thinking about it. Maybe you've heard about you should exercise or eat well, things like that. But then getting yourself to take that first step to do it, and we want to see a lot of people taking that first step. A lot of people seeking to get their kids completely immunized by 2 years of age. A lot of people just going when they go and buy their food, getting that little bar of soap. People say, oh, it's too expensive, but is it really? When you think of what it can do, that little bar of soap in terms of protecting you and your family from disease.
A lot more. To add a little on that, you can see if people go to restaurants and bars and chow bars and they don't even wash their hands with soap, we want them to stop. So all the partners we're meeting to try to develop messages that will go to address such norms, that the little things you do will save you, yourself, your income, because when you get sick, you lose money because you're going to go to the clinic. And we're telling them, or we're going to develop messages to reach out to them to tell them that, look, whatever you do, sleeping on the net will help you, washing your hands just with soap and the running water will prevent you from being actually sick. So why don't you take up measures? Your destiny is in your own hands. That's what we believe in.
Okay.
We want you to be charged. We want people to be charged, that they will do the right things that will let them be safer and be healthier and live happy and longer life.
Okay, this is just the start of a very elaborate program, and I'm sure that in the coming days we'll see it being rolled out. But thank you for coming today. You have any final words, Joan, for us today?
I hope you live a good life yourself.
Yes, I promise I will. I will. Yes. Especially for the very simple things that we need to do on our own individually to, for instance, wash our hands every day. Also, the sleeping in the nets is something I may have to consider because I don't, honestly. But we'll see. We'll see what happens, how we can all help contribute to inspire other people who are watching to live a good life. Thank you. Thank you for coming today.
Thank you so much.
Andy Opoku is the media advisor for USAID Communicate for Health Project, and also Joan Schubert is the chief of party Communicate for Health Project, sharing the afternoon with us on the relaunch of the Good Life campaign. We'll see how this goes and what we can all do in our own small way to live a better life in Ghana today. Enough of the complaining. Let's start doing some things small, one after the other. We'll go for a quick break. When we'll come back, we'll go back to the course and get to understand what that ruling today on the details for the Gitmo detainees would mean for all of us. Stay with us.